Okay, my name is Marisol Resendez, and I'm the Executive Director at Milagro Clinic.
Marisol, you've been a key player today, one of the panelists in this event hosted by Futuro RGV, promoting the work, learning more about the Prosperity Task Force, Hidalgo County Prosperity Task Force that Judge Richard Cortez has put together. You obviously chair and lead one of the subgroups. Tell us about the important points you wanted to get across in your remarks today.
Yeah, so we're part of the healthcare services subgroup, and within that we have the safety net clinics, hospitals, and the nursing schools. And so one of the things that we really wanted to do was, as we screen patients at the clinics or in a healthcare setting, we're also screening for social determinants of health, or those non-medical drivers that affect health. And so one of our biggest challenges has always been the referring process, the referral process. So when we get a patient that also needs transportation services or food or specialty care, any of the other or utility bill assistance, we're always challenged with, okay, are they going to make it into that other agency that we're asking them to go to? And so in kind of going over this challenge, we figured that we needed a better tool. And so we started researching about a referral platform, and we came across Unitas. And so Unitas is able to, it's a network, it's like a platform, a technical platform where we can get in a network and we can start sending and receiving referrals from from healthcare organizations to community-based organizations and vice versa. And so that way we want to make sure that no patient gets stuck in one place, meaning we just give them the number and you go and do it yourself, versus having organization to organization communication and better coordination for those patients or participants in general. And so we believe that this is one tool that is going to help us better coordinate those services and making sure that they do get and receive everything that they need in order to thrive.
I understand you learned about this program. It started for you. You learned about it from the East Coast?
Yeah, well, we're part of the National Association of Free and Charitable Clinics, and some of the members within that National Association were already using them. And so that's when we reached out to the local team for Unitas, and they were able to explain, and they're all over the nation. So we feel very, very sure that this is going to be something that's going to help the Prosperity Task Force, but also the RGV.
It's early days, obviously, but do you feel, have you seen enough so far to say this is going to be successful?
I have. I particularly, El Milagro has been on it, and we've referred patients over to Vida for job training opportunities. We've also received referrals from Unidos contra la Diabetes about people needing to get screened or needing diabetes supplies, things like that. And so I really feel it's very, it's user friendly, it's smooth. You do have to commit to it, meaning you need to be able to be ready to update the information on your profile. That way the other agencies know exactly what it is that you provide. And so when they have the client in front of them, they know exactly where to send them and that they're going to more than likely receive the help. And also you have to be monitoring the platform. You get emails that will alert you, okay, you have a new referral, but you do have to be able to get in there and be monitoring in case you do receive so a big commitment from organizations, but it is one that I'm sure it's going to be worth it.
And so the more organizations that are part of this, the more referrals they make, you can build up a better profile of the needs of this community.
Absolutely, and so that is one of the beauties about the platform, where we're feeding all of these referrals in it, and then we're able to pull that information. And so one of the more important things, I believe, is that we'll be able to see the gaps in services, meaning somebody's looking for something that we're not providing, and then that way it'll help us kind of make a plan in how to address those.
Marisol, is there anything else you'd like to add?
Nothing. I'm very grateful to be here today and be part of the Prosperity Task Force. Thank you.
Thank you so much for today's interview.
Thank you.